everyone for joining us. My name is Kim Walker. I'm the Training and Technical Assistance Manager with the Pay for Success Initiative here at Urban. And joining me for today's webinar on selecting and strengthening interventions is Roman, the Senior Fellow here at Urban and also one of the Principal Investigators for the Pay for Success Initiative, as well as Justin Milner, who's one of our co-managing directors and a Senior Research Associate. We also have some staff providing some background support today from our Communications and IT department. Today's webinar, as you may remember from the description that we gave when you registered, is really about evidence and interpreting evidence and how that applies to intervention. So we'll be talking about interpreting the evidence base for specific interventions, as well as the resources that can help you do that, the critical qualities that make interventions PFS ready or eligible, and the biggest programmatic challenges for Pay for Success projects and how to avoid or overcome them. So just some quick housekeeping things before we dive into quickly for those of you who are less familiar with WebEx. As you've probably already noticed, everyone other than the speakers today are muted just so that we can minimize that background noise. For today's webinar, the way we've set it up is that we'll put all of our kind of presentations at the beginning. So we'll save about the last 10-15 minutes for your questions. To type in or to send those questions, because you're muted, you'll need to use the chat box, which you should see at the bottom right of your screen. If you don't see it, you want to look toward the top right of your screen for a little chat icon bubble, and if you click that, the box should appear. You can type in your questions at any point today. We'll save them for the end, but you can send them in whenever you'd like. You send your questions, that little drop-down box, to either all participants or our audience questions. If you want to send it to all participants, everyone is able to see your question. If you'd rather remain anonymous, you can go ahead and select audience questions in that drop-down box. So just that chat box, type in your question and select either all participants or audience questions. And we get this question a lot, so I wanted to make sure everyone's clear that we will and are recording today's webinar, so you will have a copy afterwards that's sent to you, as well as a copy of the slides. So I'd love to get started just by kind of figuring out where people are today in the room with Pay for Success. So you should see a little arrow icon probably towards the top left of your screen, and there's kind of a range here of phrases that might describe where you are with your Pay for Success intervention. So I want you to go ahead and click that arrow once and then point to the box that's most applicable to where you are. So you might be just starting out, you might be in deal development, you might be in Pay for Success deal implementation, wherever you are, go ahead and click the arrow and let us know. Excellent, thank you, Meryl. So please continue to do that. If you're more comfortable, you can also use the chat box to do that and just type in kind of where you're at, but I'll give everyone just about 30 seconds or so to let us know where you are. And so it looks like we have a lot of people kind of just starting out, which is great. Welcome. People in the middle there. So again, it should be toward about the top left of your screen, and once you've clicked to turn arrow off, you want to click that arrow icon one more time. Great. A lot of people just starting out. I see you're pretty settled already on an intervention, so you know what you'll be doing moving forward. Great. Just give people a few more seconds there. And thanks for joining us. Else want to share before we move forward? And again, once you've clicked, just click that arrow icon one more time to shut that arrow off. Be more and pretty settled on their intervention or target population. One more in deal implementation. Okay, great. Thanks all for giving us that information. Looks like we have a lot of people just starting out. We're happy to have you. And if you don't see the arrow, you can just keep typing it into the chat box. That's great information too. So with that, I'm going to go ahead and turn things over to Justin to kick us off. Justin, take it away.
Thank you very much, Kim, and thanks to everybody. I'm amazed by our technical capacity to those very cool arrows, and thank you for voting. It's fun to see the range of folks and some names that we know and also some names that we don't know. I want to say thank you very much for taking the time to join us. I'm here in D.C. John Roman is in Philadelphia. Our aim today is to make this the most interesting webinar in the world, or the most interesting webinar on Pay for Success in the world today that's looking at evidence. Okay? We are going to do our best to keep you engaged and involved and interested through this next hour. About questions along the way, we're definitely going to reserve 15 minutes at the end to come back to some of the thoughts and questions that you have. So what are we doing today? We really want to do three things. And we view this as a taste test into Pay for Success, but we want to first and foremost really dive into thinking about evidence. And evidence is a tricky term, so we're going to talk about what we mean by evidence and what are some of the resources that you can access as you think about evidence in the context of Pay for Success. Second thing that we're going to touch upon is what are some of the key qualities of thinking about Pay for Success ready interventions. So beyond evidence, what are some other things that you might want to think about as you look at programs for Pay for Success projects. Finally, we're going to touch just a bit on what are some of the programmatic challenges Pay for Success projects, specific interventions, and how those apply more broadly. So the place that we want to start, it's always good to start, make sure that we're all on the same page. We think it's important to come to common definition of Pay for Success. This is not what everybody would say. I think there are broader definitions of Pay for Success that people might offer that really think about more broadly aligning government spending with outcomes that we hope to achieve. The context of this specific webinar and the way that most people talk about Pay for Success is really through specific projects and through a specific financing mechanism. So the way that we talk about it, it's got a few parts here. So Pay for Success is an innovative financing mechanism. So it's a new way of thinking about business that tries to shift risk from a traditional funder, typically government, to new investors. Provide upfront capital to evidence-based social programs, and really doing so with the goal of improving outcomes for vulnerable populations. So we are sure that you all have a solid sense of what Pay for Success is, but you can see even within that one statement the different elements and the different actors that are a part of Pay for Success projects. So I'm going to turn it over to John, who's going to talk briefly about what a framework for a Pay for Success transaction looks like.
So thank you, Kim. Thank you, Justin. Tell me if I'm too loud. I tend to be too loud. I appreciate everybody joining us today. So this is a general framework that GAO put out relatively recently that I think identifies the structure of one of these transactions. And I wanted to go through it, but before we move on, after I do, I wanted to caveat it because I think it's really important. The idea here is that government looks into figuring out what big barriers to serving vulnerable populations that that we've had trouble serving over years, and that could be individuals, that could be juveniles, that could be adults, that could be families, that could be communities, that could be streets, that could be large geographies that just simply have been intractable in our ability to reach this disadvantaged population. They contract with an intermediary. The intermediary could be a knowledge intermediary like MDRC, or it could be a financial intermediary like third sector or social finance. It depends on the deal, what the needs are. What tends to happen is that the intermediary then finds some investors, and those investors could be a philanthropy, it could be a venture capitalist, it could be a big financial services bank, where there's a pool of investors who are interested in trying to make the world a better place and achieving a return on that investment and leveraging it. They link with a service provider who is somebody who is evidence-based, and we're going to talk a lot in this webinar about what it means to identify a service provider that's evidence-based and how you can evaluate the deal, which is the last step at the very bottom of the slide, which is hiring an evaluator who then determines whether the predetermined performance targets for the intervention were met. Who goes back to the government and says to the government, look, you hit the targets, write the check to the intermediary who hands it off to the investors who hopefully then leverage that investment into something new that's also evidence-based. Last thing I want to say really quick before we switch slides is this is sort of a model of a Pay for Success transaction. Pretty much, however, every deal that's ever been done to date has, if you go back one slide, sorry, has not had one of these parties as part of the transaction. So really this is conceptual rather than a blueprint. The way this is just to say we will engage in these activities as part of this transaction, as this project, as this program, but we don't necessarily have to follow this as this is a specific model, and the car will only run if we do it exactly this way. There are lots of ways to get this car to run, and that's worth discussing. Okay, next slide. So what's the Urban Institute's Pay for Success initiative? The Pay for Success initiative is developed through a generous grant from the Laura and John Arnold Foundation. We're working for the next 2.5 years to try and collaborate with local geographies, with financial services sectors, with philanthropy, with intermediaries, with governments, to improve these transactions. We say all the time we don't want to be in the transactions. We want to make these transactions better. We want to take good deeds and get good evidence around them so the next generation of transactions can be better. And that means that we care enormously about making sure that these programs are evaluated accurately. We develop a whole set of what we call toolkit and template products that take the best thinking from people, from the subject matter experts at Urban Institute and other places writ large. We think there's an enormous amount of really effective Pay for Success 101 material that's available today. We want to make Pay for Success 201 and 301 toolkits and templates available. We want to use that to then train and provide technical assistance for people as they move into these deals. We want to listen to communities of practice. We want to hear what their concerns are. We want to feed that back into new toolkits and better training and technical assistance. And then want to share and broadly disseminate to the whole field what we've learned, not just about how to make Pay for Success better, not just about how to make government more effective, but what new evidence we've uncovered about better ways to serve disadvantaged populations.
Thanks, John. Let's dive into this. We're talking about evidence. It's clearly one of the buzzwords. It's something that popped up in the Every Student Succeeds Act 62 times. It's something that is core to the way people talk about Pay for Success. It's a buzzword in other areas of social spending and human services policy. What exactly do we mean by that? So in this section, we're going to talk about both production of evidence and why that's important, and then start to distinguish a bit between the different levels of evidence and how we produce evidence and what the benefits of different approaches, particularly as it relates to evaluation, what those give us. So the title of the slide is Evidence is at the core of Pay for Success. Really, I think we would say evidence is at the core of government services, or should be at the core of government services, is not always at the core. When we talk about evidence, we're really thinking about retrospectively, what do we know? What are the outcomes that we've learned that have been able to collect as a result of ideally rigorous evaluation to determine whether or not an intervention actually impacts the positive outcomes for a population in the way that we expect. And so we think about this idea of production of evidence. It's a funny term because evidence is really like a concept, but in this idea of production is almost this sense of once you produce the evidence, then it's there and it will always be there. And that's really not how we should think about it. Evidence is not a static thing. It's the accumulation of body of knowledge. But it is something that as we hypothesize, as we test, and as we evaluate and learn, we do grow that body of evidence so that we have a better sense of what works and what doesn't work. And what we see on this slide is what we think is an important way of distinguishing this process of developing evidence. Any program in social intervention, and the ones that we care about in Pay for Success projects and that we care about more broadly, start with an idea of wanting to improve the lives of a population. And that program, ideally, if it's starting from a good place, will be informed by the best available research that already exists and that's available evidence that's already there, and will create a strong theory of change that will really help to back what the program is and what it wants to do. The process then, though, in terms of the production of evidence processes, well, then you have a hypothesis, you have your guess of what you want to do and what it's going to impact. You're going to implement the program. You're ideally going to evaluate that, and John's going to talk a lot about that. And that gets us to the point of getting building the evidence base, and then it circles back. And so this idea of, as we continue to build the evidence base, it's continually reinforcing and being applied in further program refinement and program development. So the key point here is we know that we are testing programs and we're building some evidence of success. It does help to increase the likelihood that you'll get outcomes that you intend and avoid outcomes that you do not intend, or avoid programmatic failure. And so I've already touched upon a couple of these, but this is why this is important in the context of pay for success. Pay for success projects are very complicated, as you saw from John's slide. There's a number of moving parts, there's a number of different actors. All of this, however, rests upon the foundation of a strong program that can actually deliver impact on outcomes that we're going to be tracking. And so to have a stronger evidence base, you're going to have a higher degree of confidence that that intervention can actually achieve that impact. The second thing of evidence, and really thinking about it, is it really requires all the stakeholders from government and other actors to think critically about what it is that they're going to be purchasing. As John often says, we have a good sense of what we're doing. We have no sense of what outcomes we're buying when we pay for government services. And finally, having this sense of the field and a higher degree of confidence in the intervention impact gives us a better sense of moderating some of the risk that's inherent to pay for success projects.
So, John, again, I'm going to pick this up. So this is our evidence-based pyramid, and this evidence-based pyramid is really important from two perspectives. It's important from the perspective in understanding what the evidence base is that you are building on when you select the program to be the target for a PFS transaction. It's also important when you think about what level of evidence you need at the end of the day to demonstrate to the funders and the government that you hit the pre-agreed upon performance metrics. Now, what's interesting here is you can go either way. You can, or both ways, which is what we prefer. But either way is fine, which is to say you start with a really strong bit of evidence and you demonstrate that you implement it, or you start with a really good theory of change and you create great evidence around it. So I'm going to go through this pyramid from the bottom to the top, from no evidence into potential, promising, model, and strong. What I'd like to point out is this, even though that it's a pyramid, so it's three-dimensional, and the area of the base is far larger than the area of the apex, it's actually true that in the real world, most of this pyramid would fall into this no evidence base. These are well-intentioned programs that do not have a theory of change. They're not rooted in any evaluation evidence whatsoever. It's things we do because we believe in them, but we don't have any evidence around those beliefs. Next slide.
So we got a couple of slides got eaten, John. So if you just want to talk through them.
Right, I'll just walk through all 5 pieces. It's fine. So the next level up is the potential category. This is the category of look back to the pyramid. I'll walk through the pyramid and then I'll go to that.
We got it.
Got it?
Yep.
All right. So the potential level is there's a theory of change. So it could be that this idea has been tested in a different geography. This idea has a logical relationship between the effects of the program and the intended practices. It links an intervention to a defined outcome, and that's really important. We know what it is we're trying to accomplish, but it hasn't been evaluated in a way that confirms causality. And causality is really important. I think we all know that correlation and causality are two different constructs. Correlational evidence is powerful. Anecdotal evidence is less powerful. Correlational evidence is really a thing that when somebody is bringing capital to the table, when governments are committing to reimburse that capital invested, that's really what they're looking for, something causal. So that moves us up into the promising category. Here what we have in the promising category are things, programs, services, interventions. They can be mechanical, like mosquito netting or asbestos remediation or lead abatement or acting reversible contraception, or they can be things like behavioral change around CBT, cognitive behavioral sort of stuff. But they have at least one randomized controlled trial or two high-quality quasi-experimental evaluations. We're borrowing this language, I should note, explicitly from the Blueprints for Violence Prevention. So this is their language, but we think it's exactly right to describe this tier of the pyramid. Now you can go on. And it's important to take a second and talk about what a randomized controlled trial is. And the idea here with a randomized controlled trial is that you have a bunch of people, and people vary. In our little graphic, they all look the same, but in reality, they're not all the same. Some are men, some are women. They have different histories, they have different ages, they have different experiences, they have different educational attainment. What we want to do is to get an equivalent number of each kind of those people into the treatment group and control group so that they are, as a group, not individually, but as a group, identical. And the only thing that's different between the treatment and the control group is that one gets this intervention that we are trying to do and deliver with Pay for Success, and the other one doesn't. So any differences between the outcomes that you see at the bottom where it says outcomes and compare outcomes, any of those differences in the outcomes can be wholly and solely attributed to intervention. Yep. So multiple programs are even a step above that, right? So these have like two high-quality randomized controlled trials, because the thing is even a randomized controlled trial, which is the gold standard in evaluation, even with a randomized controlled trial, it might be it might have through the vagaries of chance lead to a conclusion that was inaccurate. So if you have multiple randomized control studies, or at least one really good randomized control trial and one really good quasi-experimental trial, where quasi-experimental trials are things where you weren't able to say as the researcher, I'm going to randomly put this person in the treatment and this person in the control, but you've created a way statistically to approximate that. If you have a couple or more studies, then we would put you in the model category. And again, the model category, now you're getting into very, very thin strata of the pyramid. The few programs fit here. And let's talk about strong. And strong programs are things where there's been a meta-analysis, which we'll talk about here, which is to say we've done a study of studies. What we've done is we've said there are 20 studies of Tylenol, and we're worried that Tylenol causes abdominal bleeding. And 14 studies say it doesn't, 6 says it does, and now we have to decide, are we going to warning label on the bottle of Tylenol to warn people that this is a possibility? Analysis does is it looks at, in this example, it's 6 randomized controlled trials, each of which have a different treatment and control group, and each of which is going to have a different effect size, a different outcome, a different difference in the outcomes between the treatment and the control. And you need all those things together and see whether the thing works overall. And the best programs are the programs like Nurse-Family Partnership, ST, FFT, things where multiple studies and have allowed us to compare to aggregate those studies in ways that allow us to conclude that, yes, when you get lots of studies, they not uniformly, but mostly all come to the same conclusion. This works. That's the strongest standard of evidence.
And this is Justin again. What's really interesting about what John said there is when you think about the pyramid And the number of programs, when you look at that, the number of programs, the volume in that area at the tip of the pyramid is very small. So really are just a select number of programs are there. I don't think it's arguing that Pay for Success should only be focusing on the tip of the pyramid, that there are other parts of our evidence that we're going to be able to tap into to think about being a part of Pay for Success projects. But I think what we are saying is the higher you are on that pyramid, the higher degree of confidence you're going to have that you're actually your investment is going to be able to deliver the impact and the results that you expect. So one example of this, there's a number of projects now. There's almost a dozen now in the U.S. of Pay for Success projects, and we want to highlight one really strong one, we think, that is the Center of Employment Opportunity, CIP, up in New York State. And this slide we stole from the GAO. It's a nice slide that shows all the different actors involved. It's an update of the slide that John showed earlier. What you don't see on the slide, however, is the evidence of impact of the intervention. So you can see the service provider there. The evidence of impact isn't on the slide, but it is cooked into this project. And so this is an example of a project that gained significant momentum after CO, Center for Employment Opportunities, did a 3-year independent RCT evaluation conducted by MDRC, and they found really strong results with regard to reduced recidivism for returning young adults back to their communities, and, returning from prison. And so that's a big finding. This is in New York City. What's interesting about this Pay for Success project, and is illustrative, is that they are now going to be delivering the same program and services in a different part of the state. So it's not going to be just in New York City. It's going to be in different parts of New York State. And what's interesting is this is an example of taking an evidence base, trying to think about how do you apply that in a new geography with a different population, and then build the evidence base even further. So in the lower right box, you see evaluator, and the second bullet is that they are conducting another randomized trial evaluation of this intervention with this specific population in these new contexts. So this is a great example of how you're looking retrospectively to see what evidence for an intervention exists, and then you're thinking prospectively about bringing in rigorous evaluation to continue to build evidence base for a project. So one question you may have is, this is great, you're talking about all these programs, you're talking about all these interventions and blah, 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 meta-analysis, blah, 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 this. Where do I actually go to find some of this work? And so we've listed a few here. On the meta-analytic databases, we're highlighting both the Kimball and Cochrane collaborations. Those are great starting points. There's also work that is also based on meta-analytic work from the Washington State Institute for Public Policy. They build another element that I'll talk about in a second, which is the benefit cost modeling, which is also really essential to thinking about Pay for Success deals. And then a third resource are what's called these What Works clearinghouses. And the number of these, depending on the area of policy, there's the What Works clearinghouse in education, there's the Blueprints for Healthy Youth Development, for whom we've modeled our evidence standards. The SAMHSA has one, NREP, the NREP. But this one that we have listed here, for the Pew Charitable Trust, is a really cool site. That's actually a comprehensive meta clearinghouse, and you can search programs based by outcome areas, types, age groups, across I think 5 or 6 of these different clearinghouses. And so you can basically, it's like the kayak, basically. It's your kayak for evidence-based programming. So if that didn't get you all to go to that site right away, I don't know what it is. Okay, so we have about 15 minutes. John, I'm going to talk real quickly about just to extend some of the conversation that we have been having around evidence, but to talk about other key qualities of Pay for Success, ready interventions, and some of the challenges. And then we're going to make sure, as I said, to save some time for questions at the end. So if you have questions in the chamber, you can start typing those through at any time, and we're logging them on our side. So we've talked about this idea of evidence building and evidence-based programs, but that has been really, we've been thinking about it more within a vacuum, right? And in the future, we're going to hold another webinar looking at the full process of thinking about pay-for-success suitability across several different variables and domains. But we wanted to hone in on a couple of areas here to think more broadly about how to think about some of the interventions. So select key qualities. These are not, this is definitely not the full comprehensive list, but these are a few things that we think are really important as those folks are in the early stages of thinking about the pay-for-success process, where you might be starting. So we've talked about the evidence. We're going to talk a little bit about prevention and also evaluation. The evidence side, we mentioned what's a really key quality of a program that you should be looking about. Even if you're not finding it on one of the clearinghouse resources that we discussed, any program that's even in the conversation of a pay-for-success project should have a really strong theory of change and should be very clear about how the intended activities and services link to a specific outcome, and an outcome that can be measured. Third bullet there, we talked about evaluation, but the third bullet is also quite important in the context of pay-for-success. Some interventions can dramatically more than others. You can think about behavior game, which is a classroom management program that I think goes down for something like $62 per person within the classroom. It's a universal prevention program, so you're getting kids in an entire school. It's relatively cheap. The impact size is not as great. You could think about the nurse-family partnership, which is somewhere in the range of $10,000 to $12,000 per child per intervention. Both of those programs can potentially be cost-effective. So the program that the good behavior game costs $60 might actually deliver benefits that have real cost savings to different public systems that could outweigh that. Same can be true for nurse-family partnership. The point is that this is a really important characteristic, particularly within pay-for-success deals that are looking to produce cost savings that can ultimately be the source of revenue for payback for the actual transaction. Another really important area to think about for pay-for-success projects is that they're going to be both focused on prevention and on underserved populations. There are billions, hundreds of billions of dollars that we spend per year on programs and services for our populace, for our citizenry. Where I think a lot of us think pay-for-success is especially important is for those places in which we systematically underinvest. And two of those places in which we systematically underinvest are on prevention and on underserved populations, which is sort of what I mean by definition. So in thinking about prevention, it's really thinking about where are some of the upstream interventions and upstream spending that can potentially divert or change trajectories of lives of vulnerable children and families that can actually prevent later long-term poor outcomes and later spending. Thinking about high-risk and vulnerable populations, this has been where most of the action so far in the U.S. has been in pay-for-success, thinking about chronically homeless individuals, thinking about child welfare populations, thinking about opportunity youth. And so these are places in which, what are those interventions that really focus on some of those populations? Finally, be an Urban Institute webinar if we didn't talk about the importance of rigorous and objective evaluation within the context of these deals. So it is essential that as places think about constructing pay-for-success projects, that you are thinking about how you're going to evaluate the outcomes of those projects at the very beginning. And what that entails, that means that you have a very clear sense of the target population and the target outcomes. That is, you would imagine that's a given. That can be a very difficult part of the process within the context of pay for success deals, because we have to be super clear about who we intend to actually receive services, make that we're not quote, cleaning certain populations, make sure that we're actually targeting services to those who can most benefit. Second really important thing about the evaluation is to be able to have accessible data. This is a major barrier. This is a major part of what the pay for success process has illuminated in places that have gotten deals off the ground, is the need for partnership between provider and public systems. This, I believe, will also be a topic of a future webinar, so we're going to go deeper into some of these topics later. And finally, it's critical to build in and ensure that the program can really be evaluated with rigorous empirical research design. We believe that that is true for really every program that's being discussed in Pay for Success, but it's really important to start out thinking about that. And hand this back to John.
Okay, so I'm going to talk. I'm going to talk a little bit here, and then I'm going to go just through a couple slides, and then I think we're ready to answer questions at that point. Kim, let me know if that's incorrect.
That's right.
Terrific. So you know, the slide is entitled. So I'm like the voice of doom here, but I think it's worth being really honest about what we're trying to accomplish here. Pay for Success is a different way of financing social service for disadvantaged populations to raise capital, shift risk, sell things that we know work, test things that we think are promising. It's really, integrate data, have actors across the system communicate with each other, figure out what it is that we buy, not just what we spend, which is what Justin said earlier, force governments to articulate what they're trying to accomplish, create performance metrics around all this stuff. It's got a bunch of really wonderful advantages for society, and we're really excited to test this idea. We are not at the Urban Institute, though, proponents of Pay for Success. We're proponents of the idea of more effective deliverance of evidence-based services for disadvantaged populations. We think this has potential, and it's worth noting what the challenges are. The challenge here is that what this does is it magnifies all the normal risks of service deliveries in ways that are really public-facing, and in ways that make people a little more reticent to be involved in these things. Governments want to see short and medium term outcomes in addition to long-term outcomes. So the pressure on a social service provider within one of these contracts is much more intense than it normally is if you just simply have a contract to serve 250 kids in a geography in a certain time frame with a certain basic rubric about what you're going to do. The pressure here is totally different. There's a reputational risk around this that is completely different. And we're seeing this in the deals. John said there's almost a dozen. That's right. We're seeing this in the UK, where service providers, in order to get access to this capital to scale or test their really well-intentioned good works, are also putting their reputations on the line. And it's really critical that everybody involved respects that concept that, if this goes sideways, it has real consequences in a way that normal transactions with the government, normal procurement, doesn's have. And then similarly, there's an implementation bit that is different from business as usual that's really important, and I think it's really good for social service providers because as they go along, there's a lot of work being done to help them course correct, to figure out which subgroups am I being really effective with, which ones aren't I being effective with. Can I learn something from the subgroups that I'm being effective with and apply it to the subgroups that I'm being ineffective with? And that could be something as simple as I'm seeing an adolescent population and my 16 to 18-year-olds are doing really well, but my 13 to 15-year-olds aren't. What can I learn from my 16 to 18-year-olds to help the 13 to 15-year-olds? Because at the end of the day, the service provider is going to be judged on the whole population, 13 to 18 in that example. And then evaluation piece of this, which is also really important. So, and I think from the Earn Institute's perspective, trying to make the world a little bit of a better place, we think this is really important. We think it's really valuable. We also see the challenge here. So you're going to have to measure stuff that you weren't measuring before as a government, as a social service provider, as an intermediary. You're going to have financial services and philanthropy asking you questions about who you're delivering services to, and most importantly, why. What are the objectives you're trying to achieve? What are the performance measures you're trying to achieve? Why are you trying to achieve these things? And then, of course, Justin talked a lot about control groups, and that's a really big issue because the way the world works today, government is really good about new inventions, studying very closely how well they work. But they spend a lot of time thinking about how well the population that they don't serve, the edges that they could have served, how well they did. And in order to satisfy the government, intermediary, and the financial services, whether it's philanthropy, venture capital, or banks, you have to be able to compare it to something, and the only way to do that is to measure it. At the end of the day, that's a really good thing. You can't replicate success without measuring success. You can't avoid failure without measuring failure. But the measuring challenges are real and new. This one is a little bit of what this webinar is all about, right? Which is helping people to understand what it is we mean by evaluation. I hear a lot of people talk about data and analytics and metrics, and you know, hear these phrases thrown around all the time, and RCTs, and I often wonder if the people who are saying these words, this jargon, really understand what they're talking about. And I think in order for each of the parties in these transactions to come together in a collaborative way that leads to efficiency and success, everybody involved in these things has to actually understand what it is we're talking about. What do we mean by a comparison group? Data acquisition, integration, and management. What does that actually mean? What is a performance measure? What is the difference between an input, an output, an outcome, and an impact? And that conversation has to happen. And if people come to a consensus that the things mean something slightly different from what's in, the scholarly literature, we have no trouble with that, as long as all the parties have agreed on what those concepts are and what they're trying to achieve. So I think it's second to last slide. And then data collection. I think one of the great potential power, sorry, my grammar's going sideways here. Great potential to improve society around pay for success is on the idea of data integration. You've got an adolescent who's in special education, they're touching the family court, they're touching the juvenile justice system, they're touching family and child services, maybe they're homeless. None of those systems talk to each other. And part of the reason why governments are in the situation they're in and why that population hasn't been able to be raised up and why they remain disadvantaged is just simply that we don't know who they are because we don't share data across these systems. The same is true of the recovering addict who's chronically homeless with a history of low history of educational attainment who's returning from prison. Who these people are. And pay for success, though, forces you to break those silos, to solve what we call the wrong pockets problem, to integrate those data, and to at least ask questions about, who it is that are most at disadvantage, and is there a way we can identify them, and is there a way to help them? And the more complicated the question you ask, the more challenge this is, but probably the bigger the success that will result. So I'm going to turn it over to Justin to wrap this up.
Stephanie, thanks, John and Justin, for that whirlwind of knowledge. And I just wanted to share again with everyone, we've already gotten some questions in, which is great. If you still want to submit, you still have plenty of time. We have our full 15 minutes for questions. And then you would type that into the bottom right of your chat box, or the bottom right corner of your webinar panel, which should be a chat box, and then to all participants or audience questions. And this is just a reminder of what our objectives were today. This helps if you're still not sure about one of these areas. Feel free to ask questions, whatever questions that you may have. As a reminder, we are going to be sending out the slides and the recording afterwards, and if you do have questions that come up afterwards, you can respond and let us know, and we'll try to get back to you there too. I know it's a lot to process. we do have, I'm just going to start rolling with the questions that we have, and please keep sending them in. And John, I thought we could start with you with kind of taking the first shot at this one about pay for success in the federal government. So we have someone curious about the extent to which the federal government has adopted the pay for success model, and for what types of programs, what the dollar amount for those programs has been, and just what federal agencies are engaged with the model so far.
Let me take a shot at that, and then I'll let Justin jump in. But I think there's been a lot of interest from the White House and the executive agencies, the Office of Management and Budget, OMB, and the Treasury has really pushed out the idea to the agencies in the federal government that they want them to be more evidence-based, and that they see pay for success as a mechanism to facilitate more evidence-based practice. The two initial agencies that really got in front of this were the Department of Justice and the Department of Labor. The Department of Labor particularly has funded a couple of the CEO project that Justin talked about was a Department of Labor grant, and it was I forget exactly what the award level was, but it was in 8 figures. It was 12 million or so. They did 2 of those, and Justice has done some stuff like that too. The Corporation for National Community Service has funded, I believe it's 8 sub-grantees at about that same kind of level. So the federal government's investment all in at this point is probably approaching $50 million. Very serious about this. There's lots of stuff in the budget for the future. But I think what's really important to note is that what they're trying to do is to seed the field, right? The analogy that was used to me about where the executive and the agencies are is if you can get the ball to the rim, they can push it through for the dunk, right? But you can't get the ball to the rim. You have to do that. And so most action has really been at the state level. It's been financial services mainly. Philanthropy has been less involved than we anticipated it would be. But on the end, banks and venture capital have been way more involved. And last thought, and then I'll turn it over to Justin. But these there is more money chasing pay for success transactions than there are transactions to be invested in. There's capital all up and down the ladder looking for places to go. They want evidence-based. They want to know what outcomes you're buying. They want performance metrics. They want government guarantees. And to date, the biggest problem has been finding those transactions rather than finding people who are willing to invest in those transactions, because the investors are there. It's the transactions that aren't.
To that, I think that's exactly right, John, and that the interest from investors has really been for investors that don't know how to calculate the risk of these types of projects. It's this sense of what's going to give us a greater sense of security about this type of program. And so I think that this webinar and what we're talking about really points to answer some of that question. One other thing I'd like to highlight at the federal level is John's exactly right. That the Office of Management and Budget really took a lead role in thinking about how what were initially called social impact bonds and pay for success could be applied within the U.S. And there's language now being incorporated in a number of different bills for agency funding. And so most recently, the Elementary and Secondary Education Act, ESEA, for the education bill that was just signed by Obama last week, actually has language to support pay for success projects in areas of funding, Title I and Title III. And so we're still interested to see how that's going to play out, but it's a really important way in which this is the federal thinking about, and Congress is thinking about how do you test this out in some areas of really traditional federal funding to also build in this type of innovation.
I'll just add one more quick thing to that, which is I know we have a few HUD people listening, and HUD and DOJ, I believe, released a joint NOFA around supportive housing and using pay for success as a demonstration product around supportive housing for chronically homeless folks and people returning, I believe, from jail and prison. So that's another federal agency. So there's definitely, as Justin expressed, a lot of interest on the federal level. Another question that came in, how are the results from pay for success studies verified? So what happens, these studies happen, outcomes are achieved, how are they, is that success or lack of success verified?
Crack at that, and we're working on this question, and it's a little up in the air right now. So in our world, traditionally there's an evaluator, and that's the person who runs the randomized control trial or the prospective quasi-experiment, whatever it is. Here we talk about a validator, and the validator could be the person who runs the randomized control trial, or somebody who sort of comes around the back and looks at the results of the evaluation and says, yes, I'm going to put my stamp of approval on that, like Moody saying, this bond is, AAA or whatever. It could be either of those things. The point is, and then the evaluator could be somebody who works with the program, as we were talking about earlier, as it develops, to make sure that they're implementing with fidelity to best practice. Not the language. The point is not the jargon. The point is the concept. The concept is, what we're really trying to do here is three things. We're trying to build upon programs that have strong prior evidence, according to the evidence-based pyramid that I showed. We're trying to figure out rigorously, transparently, and objectively at the end of the day and it's almost always one performance metric, and that all parties who are part of the transaction are convinced that it was in fact met. And we're trying to have people help with training and technical assistance and implementation to make sure that we're doing things with fidelity to best practice. So what we're doing is really bringing research into the process of identifying, delivering, and evaluating services for disadvantaged populations in a way that has never been done before, that we think sort of advances the whole practice of social services.
So add one point to that. So as John's basically describing, this is generally unprecedented. We don't think about this level of testing. We never really think about this level of proof when we think about investing in human services. So it really is a hugely different level of rigor that we're introducing into this type of government spending. What's interesting, actually, is that in some of the newer deals, there's also there's been interest in getting some verification of evaluation design, even before the project has been getting off. So, I think what's in that point is like who's calling the balls and strikes on this? Who's the referee? People on both sides of the transaction are really interested in that. They know how much is riding on that. And so there's interest at the front end of really making sure that there's a quality evaluation design built in. I think there's the one downside, the one concern is just if that gets to be a tremendous amount of overhead and programs and setting up these projects, it's going to be really hard to do this in a lot of different places. But at least in my view, and John might feel differently, in these early stages of these deals, I think it can be a good thing that we really want to make these projects as strong as possible with as clear evaluation, so we know at the outset what we're going to be looking at the end, and it's going to be a muddled decision.
Great. Scott, so I think we have some more questions coming in, probably more than we have time for. So one thing that we'll do before we close out today is save questions, and we have people's names, so we will follow up with you if we don't get to your question before the end of today via email to make sure that we can answer those. And so one I wanted to address, I'm going to try to get through about two more questions. One question about service providers. Are there opportunities for service providers to adjust or add to their evidence-based model to pursue additional performance metrics beyond those identified in prior evaluations? Can PFS-related services be agile? So any thoughts about that service provider piece?
I'll give that one to Justin.
Yeah, well, I think that's a hard one.
That's a hard one.
Interesting, because there's been two real roads that projects have gone down. In the UK, for the early social impact bond models. It really has been less model specific, really tied to the outcome, and there's been more flexibility, I think, around how those providers were necessarily going to actually get the outcomes and might be able to adapt along the way. I think there's been more focus on the model itself and really being delivered according to best practice, and we know how what has been able to get those impacts in the past. I think what I would say, and then I'm curious if John has a different thought, but I think there should still be a very strong focus on the core elements of any given intervention and model as being delivered, but they should be really flexible and thoughtful and strategic about how we do the ancillary work, such as recruitment, enrollment, and making sure that target populations are actually staying in the program. That's a huge challenge, not just for Pay for Success, but for social service provision more broadly. And I think that's area in which we should really be thinking as a field and for specific service providers, how you do that part of the work better so that you can tailor the messaging to get people in the door and make sure that they're staying in the seat.
I would absolutely agree with everything Justin just said. I think I think the UK example is really interesting and important. And UK, there's a lot of venture capital money, and the thought venture capital is you sprinkle that money around, and you buy 100 prospective social media platforms, and you only need one Facebook, and you win, right? At the end of the day, you make $1 billion on a $10 million investment, and there you go. But the fear is that, and that's really been the model they've pursued over there. Lots of innovation, not a lot of focus on well-defined programs with fidelity practice. The problem is, of course, that we're not talking about a social media platform here. We're talking about actual human beings who need help. And so, I would like to see a mix of innovation and a mix of scaling. I think we haven't talked enough about this on this call, and we will talk about it again another day on another webinar. But there are programs, there are policies, there are practices that we know are really effective that penetrate at very small rates, 2%, 5% of the target population, and we need to grow those, and it's a way to get there. But we also need to innovate. We don't want to stifle innovation. I don't think it's really about messaging. I think it's really about evidence. And I think at the end of the day, what we're going to see is sophisticated investors, philanthropies, venture capital banks who really they want to know what the risk and the uncertainty is around their investment. And messaging isn't really the thing. It's really what can I say about what I learned in a rigorous, transparent, objective evaluation.
So we're going to use in just one more final question before we close out. And again, we'll follow up with everyone who asked. We have some really great questions that we're just not going to get to today, but that we will follow up with you about. And that is, what would be the main reason why Pay for Success would not become the go-to financing mechanism for government social programs? I know we touched on this a bit, but just to kind of recap that point.
Well, I think this one's really, there's reasons, right? I think, there's probably 12 reasons, but there's two that really stand out. And it is that the transaction costs of doing this stuff are really high. The transaction costs in terms of the learning that's required of governments in order to buy into this is really high. The transaction cost of paying off profit is high. The transaction cost for hiring an intermediary and a really good evaluator and maybe a validator and maybe an implementer and a training and technical assistance person. All costs are real, and we shouldn't ignore them. And which gets to the second reason, which is maybe what we would like to see this is as a mechanism that catalyzes, that creates an evidence-based culture. And it turns out that we have existing financing mechanisms, CDFIs or whatever, that have lower transaction costs. Then we should do that instead. And I think that's our message at Urban. But what we do want to do is to test the idea of public-private partnerships, raise capital, shift risk, building, scaling evidence, and innovating.
Thank you all so much for joining us this afternoon. You have the contact information for Justin and John, and also for any general Pay for Success questions that you have. We'll be sending around the slides and the recording, as well as responses to those questions we didn't get to. As soon as you close out today, you'll be sent to an evaluation survey that's brief but extremely helpful to us in thinking about future webinars that we may provide. So please just take a few minutes to fill that out. Thanks again to Justin and John for sharing their knowledge, and everyone enjoy the rest of your day.
Thank you.